Hello and welcome to this very special episode of A Shot in the Arm podcast. I'm Ben Plumley. Well, this is the first in a short series of podcasts where we share the mic with Frontline AIDS, and we're focused on the critical role of communities around the world in breaking down the social, political and legal barriers that marginalised people face to create a future free from AIDS. And I'm absolutely thrilled to be joined by Christine Stegling, the Executive Director of Frontline AIDS. Christine, I'm absolutely delighted that we're able to work together on this project. As you can see, I'm not in the usual Shot in the Arm podcast location. We're here remote recording in Southern California. And where are you calling in from?
I'm good. Thanks, Ben. Lovely to be here. And I'm ringing in from Brighton in the UK.
Chrissy, I guess a first question for you is around what we're hoping to get out of these podcasts. You and I are both deeply committed to building the community response to AIDS, but what are you hoping over the course of the next 4 episodes?
Yeah, we're really hoping to create a space for conversation and really to showcase the role of communities and of civil society in the HIV movement, but also in the broader health conversations. And we feel that, in the last couple of years, with all the turmoil that has been going on, community voices have not been the loudest and have been quite sidelined. And we feel it is time that we create some more space so that we can be part and we can showcase and highlight the role that communities play in responding to HIV, but also to broader health challenges.
So many of us in the AIDS movement know Frontline AIDS very, very well. But for folks that perhaps are in the broader innovation and public health fields, how would you describe Frontline AIDS?
We are the biggest civil society partnership working on HIV and AIDS, and we work across the world in about 100 countries with many partners such as APH, who we're meeting today. And we work really through national HIV organizations mainly, but in several cases also organizations working at regional level, really across the world, in Africa and Latin America, in Asia and in Eastern Europe and in the Caribbean.
Well, our first episode, Christine, we're going to Ukraine. And yes, we're going to be meeting with one of Frontline's partners, the Alliance for Public Health. Clearly the invasion of the country by Russia has really disrupted, altered dramatically the sort of post-Cold War global compact. But it has major implications and impacts from a public health perspective. Why was it important for us to kick off with Ukraine?
Yeah, for us, it's really, for everybody at the moment, this is the biggest geopolitical story that occupies everybody, right? And so it has major implications, what's happening in Ukraine, not only for Ukraine and the enormous humanitarian toll that is taking for people of Ukraine, but it also has a real impact in the region of Eastern Europe. And I think I would say it has a real impact across the world on how all of us are going to respond to HIV, but also to broader health challenges. And we thought it was really important at this point, not only to highlight and to spotlight the incredible work that communities and civil society organizations are doing in Ukraine, but really take this as a starting point for talking about our broader health architecture and what a situation such as we are watching in Ukraine right now means for all of us. And obviously, in the next episodes, we're hoping to tell other stories, but we felt it was really fitting at this particular point to put the spotlight on Ukraine.
And, Ukraine is where civil society truly is on the front lines, right? When we started thinking about this, we had thought this was an opportunity to energize and build enthusiasm from public health leaders around the world about the roles of communities in driving responses to infectious diseases. But with COVID, with the invasion of Ukraine by Russia, and indeed, sort of before that, the sort of waning, the wilting, if you like, of interest and commitment to AIDS, maybe that's not appropriate. Maybe it's sort of more of an alarm call. How would you see the situation now?
In Ukraine, you mean, or globally?
I think globally, as it relates to the fight against infectious disease and AIDS particularly.
I think, as you say, when we started talking about this series, we wanted to tell some of the good stories, right? And flag some of, or spotlight some of the amazing work that communities and civil society are doing. But I think this particular moment gives us a moment to really reflect on where are we in fighting HIV and other infectious diseases and other pandemics. And I think what we have seen in the last 2 years is really a good indication of how easy it is when the world comes together and tries to address one pandemic, which is COVID, how easily other pandemics are being forgotten. Not only about what we have learned in terms of how we respond to HIV or TB or malaria, all these other epidemics that we have been dealing with over time, but it has also shown us these enormous inequalities that exist in the global health response. And yeah, we're at a really big crossroads. I think the world is putting its gaze away from HIV in particular, and is starting to think about new pandemics and the next pandemic response, and is forgetting about pandemics that are currently killing people and continue to kill people in all parts of the world, really, but very often really hitting the most marginalized people the hardest.
Well, let's welcome our other guests and get into the panel discussion. Firstly, I'm absolutely honored that we are joined by Pavlo Smirnov, who is the Deputy Executive Director of the Alliance for Public Health in Ukraine. And Pavlo is connected to us today from Lviv in Ukraine. Pavlo, welcome to A Shot in the Arm.
Hello, it's nice to see you all.
It's good to see you. Now, you and Andriy Klepikov have both really been very dedicated to sharing the story of what Alliance for Public Health is doing to international partners around the world, and news interviews and podcasts like this one. So why is it important to you to make sure that everyone knows the challenges, but also the achievements that you are facing at the moment during this war situation in your country?
Well, I think everyone is aware about the situation in Ukraine, and of course, we experience this ourselves being here, and we think it's really important to share what is like to be here in this situation, what is like to be here for our community organizations and what they experience, and for the clients they approach and serve. And I think this is something that is we have never been in this situation before, and I think not many people, I hope. And this is something that we kind of, we develop our response as we go. We're trying to be in the places where we could be most effective in this situation. And of course, we share it because I think we feel a lot of support from all the organizations who are our partners from other countries. We feel a lot of support from international communities, from governments, and this is something that we need to share because I think we really want to thank you as well.
Well, it's really great that you're joining us. I got to say, the internet connection is fantastic. So all kudos to you and your team. And rounding out our panel is friend of A Shot in the Arm podcast, Elisha Dunn-Georgiou, who is the president and CEO of the Washington, D.C. based Global Health Council. Elisha, welcome to A Shot in the Arm. Welcome back. It's great to see you.
Thanks for having me back, Ben. It's great to be here, and it's great to be in the company of Pablo and Christine.
You and I have spoken, and we did a podcast last year. We, I guess, would never have thought that Ukraine would have changed so dramatically the conversation in DC. But we obviously see the military and humanitarian commitment that the United States is making. But how do you see the public health community responding and sort of adapting to this new reality? which, as Pavlo said, we've just not faced before.
Yeah, I mean, I think, we are reacting with shock and horror, as is everyone around the world, and really trying to wrap our heads around what's our most effective response as a global health community. And I think you know this, Ben, but Global Health Council is a membership organization of over 100 members. Many of those groups not only advocate on U.S. assistance, but also implement U.S.-funded health programs, including those in the response right now. So there are things happening on a myriad of levels. I think for us, it goes without saying that conflict and war are never good for health, whether that's an individual's health or a health system overall. And so as advocates, we really need to make sure that health is prioritized as part of any package of aid and response that goes to Ukraine and the surrounding countries. I think that's equally important. And we, especially, for vulnerable and marginalized populations, as both Christine and Pavlo have mentioned, this is particularly important, not only for the health services, but also relieving and removing any laws, regulations, or policies that would enhance stigma or put up barriers for people seeking access to care as they try and flee the conflict.
Well, then, shall we just start the first part of the podcast and just think about and reflect on just what is actually happening? The impact of the invasion on HIV services in Ukraine. And Pavlo, perhaps I could start with you. First on the broader impacts to the health system. I mean, we're getting the messages that notwithstanding the direct attacks on health facilities, that there is still great resilience from Ukraine's health service, particularly from its healthcare workers. And I guess the question is, what's really the story beneath the headlines? How are you all coping?
Well, I think this is definitely true that the system is still going on, and if you're not speaking about the places which were under the heavy fighting and or were occupied and then were freed from occupation, where we have seen so many destroyal of hospitals, and basically we have cities on the north from Kiev where we don't have hospitals anymore, and there is not even medical people, and even the humanitarian aid which is coming there and with a lot of medicine, there's simply no doctors to prescribe it. So I think this is something that is disrupted, and we are working on this as well, and we are trying to think about how we can help to bridge this gap. It's temporary, of course, but there is still a lot of people who need this help. And but overall, I think the whole country have been kind of mobilized, and the war happened at once for everyone in Ukraine. I mean, everyone at their place, and everyone is now a soldier of this kind of fight, and like everyone is trying to do what they do the best, and in this situation, I think this is what we observe. I think it's full mobilization of people, of health professionals. We can see of our social workers, where they provide prevention services, testing, and I mean, there was definitely downtime in the first weeks when everyone was shocked, and I mean, particularly, this was not limited to any particular area. But I think we have it everywhere. But I think in a few weeks, people getting back and trying to do their best, in this new reality. And I think this is something also that everyone is doing more than they did before. It's you understand that this is not your regular work. You need to do a lot of work, plus you need to do a lot of volunteering. You need to look what you can, where you can assist programs where they have been dropped. The medicine where it's there is no medicine or shortage of medicine. You need to call volunteers and think about where to get it. So I think everyone is doing their extra mile or more to get the system going.
I mean, the so-called rationale for the invasion was essentially the denial that Ukraine had its own identity, its own sovereignty. So yeah, I can completely see that this is requiring a mass mobilization of citizens in ways that just might not have been expected, and certainly not expected since the end of the Second World War. But drilling down, Pavlov, what's it looking like for people with HIV who are on treatment, who may be concerned that their supplies of ARVs may be interrupted, and clearly the major health implications of that. How are your clients coping?
Well, first of all, you need to understand that there is a different situation for clients on the East and on the West. And those clients who've been occupied territories, they're fully in different realities right now. And those clients who had to move their families and themselves to the safer locations, it's a different situation, of course, as well. So there's many different scenarios, and we have observed all kind of issues, including there was some disruption of treatment as well, and because people have been moving fast, they didn't even pick up their documents. So when they arrive at the new places, they need to start from the documents, then need to look for the health service providers, and this relates also to HIV treatment. This relates to methadone treatment, which a lot of people have been receiving in the East, and there's a big population of clients there. And of course, a lot of them have been moving in those few months to the western part of Ukraine, and we've seen a lot of lines of clients trying to get their methadone in the new locations, which is also kind of a heavy kind of workload for those medical facilities, which were not prepared to cope with a double or triple number of clients, especially in the west part, because they've been not having a lot of people. Now they have a lot of people moved to these locations.
And harm reduction, particularly for in the context of injection drug use, is a complex set of interventions. But how has harm reduction evolved given this disruption and the massive movements of populations? I guess, Andrei, how are you defining harm reduction in this new environment?
Well, this definition of the extended package of harm reduction, which once was quoted by WHO, which had I think 9 different lines and all kind of services. Not only needle syringe exchange and methadone therapy. So I think in this situation we have been basically this package have been expanding, I think, enormously, because all the issues which clients are facing right now, they need to be addressed. The issues I would even start from something that we hear from our community partners, that clients have been experienced not only disruption of their drugs, of the normal ways they got their drugs, and I'm speaking about legal drugs, but also about the street drugs. And of course, this definitely had effect on the quality issues, and overdose risk increased because all this have been disrupted. And also, I think that what is important is that some clients have been experiencing psychological issues. There's a lot of stress, a lot of fear, and this is something that we never addressed in our programs. Our programs was quite basic, so I think this is issue of mental health which need to be quite improved right now. And going back to the basic needs, a lot of clients who were, they lost their normal income or whatever income they had, even irregular income. A lot of clients have been moved, so they need to look for places to stay. a lot of clients have children, so there is another issue. There's a special category of clients with children. So, I mean, and we need some shelters, we need some day centers for the clients to keep their children while they will be, looking for their income in the new locations. So all these issues which been kind of outside of our harm reduction package, I think now are coming to this package, and without addressing those needs, we will not be able to talk with clients. They will not be really able to talk to us. So I think this is something that is definitely changed. Yeah.
I mean, Elisha, does this resonate? Is this what you're hearing in policy circles in DC? Do you think the public health community is aware of this broad array of needs that groups like the Alliance for Public Health need?
I think yes and no. I think that there has been, from my view here in DC, more conversations about health in Ukraine than I've heard about in tandem with other concurrent crises going on in Ethiopia or Yemen or Afghanistan. The list goes on. So in that sense, yes. But listening to Pavlo right now on like just one piece of the health sector, absolutely not. Right? I mean, all of those things that you just said, just about harm reduction. I mean, I think then about people outside of the need for HIV services, people who need insulin, mental health of children, family planning and maternal health, right? I mean, all of those health needs are tremendous. So I think there is, in theory, an understanding of that. And certainly there's been a lot of focus on the attacks on healthcare facilities and destruction of hospitals. I think in terms of raising awareness, we're sort of lucky here on two fronts in the U.S. political spectrum. One is that we have Samantha Power as the administrator of USAID, right? A woman who is an expert and has a tremendous passion for addressing humanitarian crises. And we also have a president that believes in multilateral cooperation. So that those two things are those are a big deal. That's maybe a low bar for politicians that are leaders, but we're good. We're here. I think, and of course we've seen PEPFAR has mobilized and is supplying ARVs. So there are things happening. I think, though, this piece that we still struggle with is we have to work within the global architecture that we have. And so we have not really gotten good at taking the kind of behemoth of global health and development and really meaningfully engaging and preparing local organizations for times like this. I mean, we saw this with COVID, we've seen it with other crises, and we just haven't been able to, put out the fire and build a new house at the same time, essentially. So I think there's money, there's political will, money is flowing. I mean, European countries have also been doing an amazing job of providing services. But it's like, how do we get that localized? How do we have that ready to go rather than having to build the system each time from scratch?
Yeah, and we'll come on to the resilience of what we call the global health architecture in a little while. Christine, Frontline AIDS and the Alliance for Public Health have worked together for many years, many decades. And I just wonder how the partnership model that Frontline AIDS has created, how effective that has been in supporting the Alliance for Public Health.
Yeah, thanks. Before I say anything about that, I really just want to say something in terms of our colleagues in Ukraine. We the night before the invasion, I was actually speaking to Andre, the executive director for Alliance for Public Health, and I think everybody still didn't think this was going to happen the next morning. So we had our last email at like midnight, and then the next morning I woke up and it had happened, and it really, it was so shocking that a working relationship in the case of the two organizations of over 20 years, out of a sudden it was such a different reality, right? And I just want to give kudos and just say how much, how amazing Pavlo and all the other, and Andre and the whole team at Alliance for Public Health have been. I think, you have been so strong and focused and resilient in the face of such horrendous realities. I just wanted to acknowledge that. For us, you feel a bit helpless when you're on the outside. These are our friends, our colleagues, right? And out of a sudden, it's like they're in bomb shelters and we can hear sirens and they're fleeing their office and they have to reestablish themselves. So they've done such an amazing job. So yes, the first thing when it happened, the first thing we did is what we always do well in the HIV movement. We started to organize, right, and we called the partnership, and we within a few days said, okay, there's lots of things happening, but when we spoke to Andre, it was that immediate help that is so often missing, right? We just need small amounts of money to move people, to buy food, to do things, and that's when we launched our appeal as the partnership. We are a partnership of organizations. And so we launched a Ukraine appeal, and many very generous people supported that, and that allowed us very quickly to give not millions, which is what is also needed, but those small amounts of money. And that also came from within the partnership. And one of the most heartwarming things I faced in the first few days was one of the partners in Latin America saying, if people need to be evacuated, we are here, they can come to us. And that meant as the people that we've been working with over so many years. So people really mobilized. Our appeal is still there. You can still donate to that at our website, frontlineaids.org. Donate. But so that was the first thing we have done. I think what's really come out is in this is our model of working. So Alliance for Public Health is a very good example of how Frontline AIDS evolved over time. Alliance for Public Health was a country office of what was then the International HIV/AIDS Alliance, but then became an independent NGO in its own right in Ukraine, and has really been a leader in Ukraine on responding to HIV, but has never stopped being a very integral part of our global partnership. And in fact, to this day, even in these circumstances, still takes leadership in one of the areas of our strategy that Alliance for Public Health is actually leading on. So I think what we have seen in terms of the model is it's our agility, it is our long history, and it is also that solidarity among civil society partners across the world in this partnership, that people really got together very quickly and said, we want to help. What can we do in our framework? And there's obviously other things we have done as Frontline AIDS, such as also liaising with other donors, trying to get bigger support to Ukraine for Alliance for Public Health. And that happens in a partnership that is bigger than just one national partner or one regional partner.
Are you seeing donors, how shall I put this, cannibalizing existing overseas development aid and redirecting it to the crisis in Ukraine, or are we understanding that there is an urgency of additive investment that's needed?
I think it's a bit of a mixed picture. I think some donors are putting on the table additional resources, and I think especially at the beginning, and some of the multilateral donors, such as the Global Fund on HIV, TB, and malaria. But there are also donors where we are seeing they're now saying we are taking our contribution, especially our contribution to receiving refugees in Europe. So Sweden has just announced a week ago that they will have to cut their development aid so that they can support Ukrainian refugees. So that is a very worrying thing, right? So because this war is happening, the other needs are not going away, and the other programs don't need less support. So there is a real issue here where we need to talk about this needs additional resources. It can't come from existing resources, because all we are doing is we're shooting ourselves in the foot, right? Because we're creating further vulnerabilities in different populations somewhere else by doing that.
So I wonder if we could sort of move to the broader context and, just what the response to AIDS was like in Ukraine prior to this. and the question of an Eastern European epidemic that I know was of great concern to public health leaders. And Pavlo, I wonder if I could start with you. Ukraine, I think, has the second largest epidemic in Eastern Europe. What did it look like? Where were infections? In what populations were they coming? And how did the country balance that sort of evidence and rights-based approach to addressing the epidemic?
Well, the epidemic started in Ukraine from the group of mostly people who injected drugs, and this was the big epidemic of drug use, particularly self-made. I mean, in Ukraine, everyone was making their own drugs. It was not any kind of imported substance. I think this was less of the case, but because people were sharing a lot, they've been infecting each other in quite big numbers. And we at the beginning of 2000, I think we have a huge number of people who've been using drugs and have been infected or were infecting. And I think that what about that time when the Alliance has started to work in Ukraine. And this was basically our biggest population from that time, and we're still working with this big population. There are some other groups, of course, sex workers, men having sex with men, people who are in prison. I think all those groups are risk groups, and we have a big number of cases among them. But people who inject drugs and who use drugs, this is the biggest concern. And we've been lucky to get funding. Actually, first of all, it was the smaller project from International HIV/AIDS Alliance, and we've been country office, as Christine mentioned. And then with the Global Fund, which have started to support us in 2004. And actually, Alliance was one of the first recipients of this funding. With the kind of technical help from the Brighton office. And I think this is how we've been able to scale up. Because, before the Global Fund, we had some harm reduction initiatives. They were smaller scale. They had not really impacted situation in the country. With the Global Fund support, we've been able to do a lot of work. We've been able to support so many different community initiatives, different organizations in all regions. So I think this is basically Ukraine was lucky to have this very, very active community groups on the ground, and I would say a liberal government attitude to this. I mean, they were not really supporting with funding, but they were not making any barriers or we're not really helping, but also we're not really intervening.
Unlike what's happening across the border eastways, and we'll come on to that. But hearing you, Pavlo, it just strikes me that what we've learned from the AIDS response is that with marginalized populations, the role of civil society becomes absolutely key in getting services to affected communities. So I just wonder how, during this period prior to the invasion, you saw a growth, a flourishing, perhaps an establishment of civil society engagement. How much of a flourishing was that?
Well, this was more than 100 organizations and a huge number of people. Actually, a lot of them were volunteering, like you have the case right now. A lot of this initiative started from without funding. I mean, there's just people, they wanted to do this and they were looking for funding, but they were not, they were not framed by it. It was just, their support to do whatever they wanted to do already. And I think the other important thing that we have been able to basically support all kind of best international programs. I mean, whenever we had any good example from other countries, we've been able to support it in Ukraine. So there was no limit in terms of what we could do, and it was quite flexible. The Global Fund was quite flexible in these terms, and I think whatever we could, we did, and it really in 10 years after we started, I think we had observed that we have decreased the number of new cases among people who inject drugs, particularly among younger the people, and we have observed quite a good drop of the new cases overall in Ukraine. I think this was the achievement basically of all these community organizations which we supported, and without them it was not possible, I would say.
Yeah, and Elisha, it strikes me that a lot of the support over the last few years also came from American organizations, US-based organizations, members of the Global Health Council, and the organization that I used to run before we folded it, Pangea. It indeed was one of the partners that helped the country set up harm reduction services, particularly in Crimea, and we'll come back to that in a second. But I just wonder whether you feel there is a heritage in that support that can be called upon in this next phase of support for Ukraine.
Yes, I mean, we are a public health coalition, right? So we follow the science and support the science and the interventions that make the most sense for health. I think that, as we know, doesn't always drive political decisions, unfortunately, or financing decisions. So there certainly is, in our own approach as a council, that foundation of public health and evidence in advocacy that we do, whether it's with the US government or other multilaterals for what needs to happen. I don't think that that's in controversy at all. I mean, I will say, listening to Pavlo and just to echo Christine's words about the amazing work they're doing, I think in this response, it's so clear that we place such a heavy burden on civil society to carry public health. And given what we've witnessed in COVID and other things that have transpired, we are asking so much of the people who are our healthcare providers. And that piece of the policy puzzle has not really been addressed yet. I think we saw struggle over that in COVID, and we continue to see it. But I sometimes feel like our community's ability to organize and mobilize ourselves, even in the worst times, is in some ways a detriment to us, because we are sort of a can-do, we'll fix it, we will struggle through to make sure it happens. And I don't know if we always get the attention and the resources and the protections that we need in all that service. So I think as we move forward in this, addressing how we treat health workers, what it means to be a healthcare worker, needs to be part of the response. And that's a very broad definition, right? I mean, Pavlo mentioned social workers, community health workers, outreach workers, even people who we may not consider as part of the health system, but those that keep the facilities clean, right, and safe. And so that's where I think we have some challenge moving forward, and not necessarily a legacy there to drive us. We have to be a little more innovative about that. But we are definitely about following the public health protocols. And that's what bases our advocacy.
Yeah, heritage versus innovation. I think that's spot on. And Christine, I'm sorry. I'm told and instructed that I must call you Christine. And you and I are dear friends. We go back many years. We've driven across a torrential raining Bay Bridge in San Francisco to meet with funders. So my apologies for not being suitably formal. But a question for you around, trends in donor funding during this period. And, the Global Fund particularly, Pavlo, Elisha have spoken about its critical role in building the Ukrainian response. But of course, the Global Fund is moving away from supporting countries that are now considered middle-income countries. And I mean, it's debatable, given the emergency now that is faced in Ukraine, how that will play out. But over the course of the last decade, particularly, did you see donor interest and support for Ukraine wane or become harder to attract?
Absolutely. And I think, that's not just a problem for Ukraine, right? It's a problem everywhere in the world where, unfortunately, a system that was never set up to determine where development aid should go is now being used for that, which is a classification of countries into low and middle income or upper middle income countries. It's an ancient debate about whether or not somebody should change why we're using that classification. But obviously, it's a real problem, and it was a real problem for Ukraine before this most recent crisis. That it is very difficult to make an argument for outside assistance to go to countries, especially from the Global Fund, but also from European donors when these countries are middle income countries. So the argument always goes governments must pay for those responses themselves. And there is obviously truth in that. If you have more income, then you must use some of that income to fund your own health systems and your social security systems and so forth. But we know from the AIDS response that what very often happens is that money, that governments don't allocate money, especially for things like harm reduction or programs for sex workers or men who have sex with men and so forth, and very often not for HIV programs. They might fund ART, they might fund medicine for people, but they will be much more reluctant to fund prevention programs, community programs, programs that address the structural barriers that we all know are still in the way of really ending AIDS. So this whole conversation around money flows and resource flows and whether or not this classification around countries' income status is something I think Ukraine will be a good example now to say, now see what happens, right? There might be a lot of influx of money now, and none of us has a crystal ball. We don't know what's going to happen in Ukraine. We all hope that this is not a long-term situation. But let's say, for argument's sake, this is over in 2 months' time. What will happen then, in terms of money flows and support? And as I say, this is not just a specific problem in Ukraine. And I think we have done lots of work, all of us, to show that the minute that those resources are not flowing anymore, we see rises in epidemics, especially in drug user communities, especially in LGBT communities or sex worker communities.
And of course, viruses don't respect economic classifications by the World Bank or others. There's something that strikes me from what the three of you have said, and I think in a way it almost goes to the heart of what President Putin wanted to do with Ukraine, and it's a real clash of cultures. The idea of the greater Russia and the very traditional conservative values that it purports to promote, versus a more liberalized, progressive, individual and support for the individual approach that is so central to the AIDS response. And I was just thinking, Pavlo, as you were describing the harm reduction needs in Ukraine, remembering that Putin first accused the Ukrainian leadership of essentially being drug users and drug dealers, and I think we have a really good example of what would happen should, and hopefully this won't, but should there be greater military success by the Russians, and that's in Crimea. And I wonder if you could just sort of share what happened after Russia took over the Ukrainian territory as it relates to harm reduction services and people who were accessing them.
Well, this happened in 2014, and it was a different scenario than it's going right now. Of course, there's no fight, but people were still, their life changed in terms of services, and this is particularly related to patients who received methadone, because in suddenly in one day they become not able to receive their medications. So a lot of people have tried to move to Ukraine, and but those who couldn't, they were just going through this by themselves. And I think there's also reported cases of people dying just because of the hard health consequences they had after that. And of course, people had to switch to the street drugs, and there was cases of overdose. And so basically, it was coming back in the history of where there was no programs. When we started, actually, Alliance was one of the first organizations who started to provide methadone in Ukraine. And when we started it, of course, Crimea was included in this whole project because it was part of Ukraine at that time. And when it was occupied, uh, those people just left without any medication. It was also the same situation with the east part of Donetsk and Luhansk region, which were also occupied, and at some point they run out of the medication, and there was no. So basically, this part of harm reduction was not acknowledged by the new, the people who were responsible at that territory.
And if I recall correctly, I mean, the invading troops actually removed methadone and other medicines from pharmacies. So it wasn't just a sort of running out of supply. There was a very intentional removal.
Yeah, I think this is something that is, I think, will be we will observe right now as well on the occupied territories. So this is something that Russian troops do. They removed medicine, they removed food. They removed some supplies of the wheat and moved it away from the Ukraine territory. And so this is something that they do everywhere, where they are. And yes, the cases when the program stopped, and this was basically the substitution treatment is something that is so so unacceptable for Russians. There's no reasons for that. It's just total fear of the methadone or whatever right now.
Did you see any impact in terms of supplies of HIV medicines? I mean, there would be concerns about long-term supply being continued, but did you also see that, treatments were being removed, supplies were actually being consciously removed, or was that not part of the occupation?
Well, it's too early to say. And well, with this heavy military activities, there's basically they don't think about any particular disease or infection. I think we have the cases when the equipment from the hospitals was moved out, not only medicine. So I don't think they will be just choosing HIV medication or anything else. It just the whole anything is stolen and removed. We observe it in the north part of Kiev Oblast, Kiev region, where there's basically everything that was that they could move, they moved out. So it's I hope that these territories will be released, and we will be able to supply people with the medication, with the treatment. We are thinking about even right now in Alliance. We're thinking about we have this mobile clinics, mobile vans, which are actually part of the Global Fund project, as well as the PEPFAR supported project, which is mostly focused on HIV tests and optimized case finding project, which has been running for years. And so we are thinking about this as the good model, actually, to provide services to the areas where there is no infrastructure left. And we can quickly, this rapidly deploy those teams on these fans and provide services, as well as provide services for refugees in the areas where they move to the west part of Ukraine. So I think this is something that we are thinking about, and definitely it's really, as I mentioned in the beginning, it's really not uniform situation. So every part, every region, every city has their own circumstances right now, and like Kharkiv, which is not occupied, but they've been constantly bombing and destroying all the hospitals and all the systems. People are trying to escape, and those people who are left, they experience a lot of problems, including lack of medication. And in the beginning of this, we even have used, we have allowed our organizations to use syringes which were bought for harm reduction. They have a stock of supplies, and they had to provide like some percentage of this to the hospitals, because hospitals basically had a lot of people coming in with all kind of wounds, and they run out of syringes. So this was, something that we were also doing. And what I wanted to say is actually that it's definitely much more clear what should be done when you talk to the local organization in these cities. And this kind of funding flexibility is so much appreciated and important right now. The one which is right now done by a global fund, they have some flexibility in terms of addressing some very basic and emerging needs. The funding which we receive from Frontline AIDS, which Christine mentioned, this is something that we don't have time to to apply for funding and to have the proper cycle of grant review and proposal and requests and so on. So I think this is something that should be done right now. People should be evacuated right now. People should get their first aid right now, and get their medication as quickly as possible in the new locations where they are, or in the locations where they decided to stay despite the situation.
Pavlo, I had an aha moment as you were speaking around the use of mobile clinics, and both in poorer, marginalized communities in the United States, the use of mobile services has increased dramatically. So, Elisha, there's something we might perhaps come back to and talk to some of the expertise in different settings around the US and see how that could be adapted and offered. The other thing, Pavlo, that you said was the flexibility in funders' attitudes and the willingness to, let the folks on the ground drive the agenda. And I guess that's something that we're beginning to see in development funding more generally. But I do wonder whether that's going to be a trend that is going to increase, because we see how well it has supported folks in Ukraine. I wonder if we might turn our attention to the sort of broader impact of global health on of the invasion in Ukraine, and just what this means in 2022 and moving forward. Of course, this year is the year of the 7th replenishment of the Global Fund, and President Biden is hosting the replenishment in the fall, in the autumn in the United States. Elisha, the administration has already made a major commitment, which we hope Congress will appropriate and approve. But do you think the US will stand firm, or are you concerned that that these other trends, these other concerns may force a reprioritization of funding?
Well, I think, like Christine said, that there's always a concern that money gets shifted around, that you rob Peter to pay Paul, I guess is the commonly used expression. I have confidence that the US is going to hold replenishment and contribute. I think it's clear to everyone, I hope, that how valuable the Global Fund is and what a difference it has made in the lives of millions of people, not just on HIV response, but let's not forget tuberculosis and malaria as well. And we certainly see the growing numbers that we don't want to see of TB given COVID crisis, and now the war in Ukraine, that those numbers are not looking good either, and people haven't been getting TB services because of these other issues. So yes, I'm not going to give a percentage certain, but I feel good about it. I think the challenge, and just to say, Friends of the Global Fight in the US has been doing a tremendous job of mobilizing the advocacy community, not just here, but in conjunction with other Friends organizations, to make sure that the US does hold firm, but also that commitments from all donors are good and what we need in this moment. So we have a road ahead of us. I mean, it's closer than we think it is, but we do, as a global health community, need to make sure that replenishment and good and adequate replenishment remains a priority for all donor countries, not just the US.
And thanks for giving the shout out to Friends of the Global Fight. I mean, they've done an incredible job, haven't they?
They're great.
Chris Collins and his team. Yeah, we love them. Absolutely. Great. And Chris, of course, is a friend of a Shot in the Arm podcast as well.
Yes. And a member of the Global Health
absolutely.
Council.
Yeah. and I see from their advocacy that they're now working with Friends of the Global Fund Europe, with groups like GFAN, really to now turn the attention to Europeans and European support. And I wondered, Christine, what maybe you're picking up and what your colleagues are seeing. What do we need to do to make sure that other donor countries invest and commit to the Global Fund, particularly post-COVID?
Yeah, I think I'm just to echo. I also think that Friends for the Global Fight and Chris and his team have done a really excellent job spearheading that call for the replenishment. And I share Elijah's optimism for the US. I'm not entirely sure yet if I have the same optimism for Europe. We all know the UK has done a major turnaround on their own development aid budget. We are no longer doing 0.7. So that's a big problem in the UK. And for some of us who got many programs, in our case, 3 programs, got called off in the middle of the program. So that doesn't mean the same thing will happen for the Global Fund, and we all do our very best to continue lobbying for full replenishment and really making the case for the importance of multilateral mechanisms such as the Global Fund. I think the jury is still out what European governments are going to do, because not only are we dealing with the situation in Ukraine, but we're also dealing with the worldwide recession and economic downturn for many of these donor countries, because this comes at the very, what some people think is the end of the COVID pandemic. We're not entirely sure if it is the end of the COVID pandemic, but fiscal space is restricted, right, and is tight. And so the arguments needs to be about why this is very short-sighted if people stop investing in global health programs now, and why it is short-sighted if you are not making sure that communities and civil society actors are very integral part of those programs. But yeah, I think we are in a difficult space as the global community to make those arguments, and we need to make sure that they're being heard and that we're getting the space. And that's part of why we want to do things like this podcast, so that space is created for people to keep on talking about why it is important.
Pavlo, if you have the mic, if we share the mic with you, what would your message be to donors considering the level of their investment in the Global Fund right now?
Well, I think Global Fund has been proven as a really effective and very efficient way to fund public health emergencies, including HIV, TB, and I think a lot of what is in the package as we speak. Yeah, it's not only only testing and treatment. It's a lot of things that should be funded along with those programs. And I think we see in Ukraine right now how important it is for the program, because just in the first days after the war started, we've been able to support. I mean, we've been from Alliance as principal recipient. We've been messaging to all our sub-recipients who've been receiving the funding from Global Fund that they can use this funding to to pay salaries in advance, to support people evacuation, to to help to save lives of people if they need to, and this was really important for all these communities, all these clients. I think this is something that was not possible without this funding, I think. And what we can see now, it's we are developing our response as we go, and it's really hard to predict, as you say, where it will, where it will move. But definitely, this needs a lot of support, and all these people here in Ukraine, in all these clients here, they really look for this support, and we've been doing our best, to provide it to them as fast as we can. And I just want to thank you, actually, all the donors which we right now have, big donors and smaller donors, and Global Fund and PEPFAR, and the governments and all the new organizations we are working right now in the humanitarian kind of issues, because this was not something that we did before, but we had to, to invest our time in the humanitarian aid as well, because we understood this is something that is really basic. We've been supporting humanitarian convoy. We've been transporting a lot of medicine, a lot of equipment, even methadone. I mean, Alliance have transported methadone, which we never been doing before, because it's something very specialized that police should be doing. But this kind of circumstances is everyone is doing what they can. So I want just to thank you for your support, and I think it's really important to continue. And I'm really also glad that here you have representative from the United States and UK. Those two countries are supporting, I think, Ukraine the most. I'd like to thank you.
Well, and Pavlo, we will share your message loud and widely. It does strike me that the flexibility of the Global Fund model that was able to come to your aid so rapidly, that flexibility of its support to Ukraine is a real justification why the Global Fund needs to secure its full replenishment this year. I wondered if we could touch a little bit about the global security agenda. And Christine, you had just raised the point about how we get our message across in this sort of post Cold War, new Cold War context, as it were. We're still struggling to find the phrase to describe it. And it made me think of some of the writing and advocacy you've done, Elisha, around redefining the global health security agenda, and that we should move essentially away from defining it in purely binary national security terms to a broader solidarity agenda. And I wonder if you could perhaps explain that a bit to us, and really to see whether your thoughts have evolved since the invasion.
Sure. I mean, I think you noted this, Chris, but from our view, the work that we've done is really on getting that solidarity piece into the security conversation, and that we find too often governments conflate national security with health security, and base decisions around global health on conditions that could threaten their own populations and economies. And from our view, that's not good, right? That a global health security approach requires something that's multidisciplinary, holistic, and really centered on the safety and security of all people, not just a particular country's population. And it's how do you do that pragmatically? I think there's many of the things that we talked about today that both Pavlo and Christine have brought up around community engagement and inclusion, and really looking at things through a health equity lens that emphasizes civil society voices, and not just voices, but shared decision making. I think that we often say, oh, we're lifting up the voices or we're including the voices. Let's just not include them. Let's have an equitable inclusion so that there's shared power and decision making that really places all of this development assistance and funding in the context where people are living and working, and that we really look at everybody's human rights and everybody's safety and security. So I would say my views are only invigorated by this. I haven't shifted to thinking like, oh no, we shouldn't be doing that. No, I think if anything, hearing from Pablo and others about the local response and, how connected communities are to the situation on the ground, and also going through it, right? I think like, let's not lose that. People who are working in the community to deliver methadone or other health services are also going through the war. And so when we talk about national security, we can't just toss that out. There's safety and security in its broadest sense, real human security that needs to have a part of this conversation.
It's tough for me because I played a very minor bit part in the early definitions of global health security back in the early 2000s with Ambassador Richard Holbrooke and indeed the then executive director of UNAIDS, Peter Piot. And, the idea was, and I Richard Holbrooke's words resonate to me this day, the health of a South African miner is fundamentally important to the health and well-being of a steel worker in Ohio, and that sort of connection was so important to me. But I've got to say that during COVID, a comment that Tedros made, Dr. Tedros, the Director General of WHO, this truism that nobody is safe until everybody is safe, really, I think, has transformed, for me, certainly the way I think about the role of health in the global security agenda. And Christine, there's a very, very specific advocacy message for Frontline AIDS around the global security agenda. And that's the role of communities, both in terms of having a leading voice and as implementers, but also getting funding. And I wonder how your advocacy has evolved. Has it evolved potentially following on from this dramatic invasion?
Yeah, I think it's a combination, right? It's the invasion and it is the experience that we have just all been through with COVID, where we have seen how, as much as we all agree with Tedros, nobody is safe until everybody is safe. But unfortunately, that's not what has been ruling the global health agenda, right? So was really quite a shock for us as an organization. I think the first few months of COVID, we thought this is the moment for global public health, and we now turn it around and we're all doing this together, and people will understand that it's important that everybody enjoys good health and it doesn't matter where you sit in the world. And very soon it turned, right? And so out of a sudden, people had access to vaccines and others didn't have access. And I think that has really sharpened our mind and our advocacy messages around really making sure that these agendas are not decided in Washington or Geneva, but they are decided with with everybody. And the location of power is not just where the location of money is, right? And the power of decision making is not just equal with where the money is coming from. And so that has definitely sharpened our agenda. We've done quite a bit of work around, trying to engage in this conversation around preparedness, pandemic preparedness. And again, where is civil society in that? Where are communities in that? It's a very tough it's tough to create that space, meaningful space, not space that somebody says, yes, and we invited 2 members of civil society so we can say they were there. No, meaningful space that really gets people to have a view and to influence what is going on. So that's has definitely sharpened our agenda. And it's been a difficult balancing act for us to balance that agenda with ensuring that we continue talking about HIV, because that's what we are about as a partnership, about ending AIDS for everyone everywhere. And that is not going to happen unless there is a real rethink and restructure in the global health architecture and in the way that we make decisions globally.
Yeah, I got to say, I was shocked and shaken at the very nationalistic responses that emerged as COVID took hold, and particularly as it related to vaccine supply and distribution. And the lessons we thought we had learned from the AIDS movement, well, clearly they weren't baked in. But I think that's a conversation maybe for another time. All three of you have touched on something that is dear to my heart, and that is, and it sounds rather tacky to say it, the global health architecture, but the way in which the international community responds to the AIDS epidemic and other global health priorities. And I'm thinking that the last couple of months, the international community perhaps has not been at its best. I'm thinking of President Zelensky's comments to the United Nations Security Council. Are you ready to close the UN? And it really begs the question whether the Security Council, the General Assembly of the UN, the multilateral and Bretton Woods institutions are fit for purpose. And I think it really comes on in our context about what is happening to WHO and to UNAIDS. And I guess the question, for all three of you is, are we at a point really where we have to fundamentally rethink and reinvest in the mechanisms that support infectious disease responses? And maybe, Elisha, I could start with you.
Sure. That's a big question. I think when it comes to WHO, starting to invest would be something good, right? For years, WHO has planned all of its efforts around a budget where only 16% of it is sort of guaranteed through assessed contributions. Hopefully that's changing, right? We've seen some positive movement about moving that to 50%. But I think if you think of everything that WHO has been doing the past few years, and even just these few months, WHO Europe in coordinating the health cluster response in the Ukraine crisis, we have to prioritize what we're funding here. We have to put value on the things that are saving people's lives, and again, follow the public health response. So I think there is growing understanding, maybe not growing fast enough. And I hear Christine saying on the global fund replenishment, like she's not that sure about the Europeans. I do think that there is going to be some architecture shift. I think WHO and the sustainable financing piece will pick up. I think there's been talk of a multilateral pandemic response fund, which I agree with Christine is very opaque at the moment and could really fail if it's not an inclusive mechanism in its leadership, right? And that we have not only what we would consider recipient countries of funding, but that we also have civil society and affected populations there. And that we don't forget that HIV is a pandemic. I really do think that, I know you said that earlier, Christine, but it's not, those words are not connecting to one another in the way that they should. I also think there's been talk of sort of a global health threats council. Whether that comes to fruition or not is another piece, but there is movement around some kind of pandemic instrument, right? That WHO would shepherd through, similar to the instrument around tobacco that happened years ago, that would really hold countries accountable and hopefully open sort of new pots of funding for this kind of pandemic response and the global health architecture. All of that needs to be additive to what's already happening. It cannot be a shift of existing resources into that sector. And all of those things not only need to be additive in resources, but need to add value and not be duplicative, right? Magnifying, yes. Complementary, yes. But we shouldn't just be setting up these new architectures because we're not that sure about the old one at this point. So there's a lot of things in play. I don't know how, I don't have a good sense of how quickly things will move or totally come together, if it's going to be sort of a piecemeal experiment over the next 10 years. And so then it's, again, really falls to civil society to hold governments and commitment makers accountable for what they're saying the change is going to be, and make sure, again, that it's inclusive and comes through that equity lens.
So one final discussion area, if you're all okay to stay on for a little longer. This conversation has really emphasized to me that the geopolitical battle that is being fought out in Ukraine, well, the AIDS response is central to that. There is an evidence and rights-based approach that we know works, and there is a authoritarian and controlling approach that will just drive the epidemic underground. And it seems to me that that HIV and AIDS, this is a crucible on which this broader geopolitical fight will be fought. And Christine, it then begs the question: if we look at our health infrastructure, our global health mechanisms, we can see this tension really strongly in UNAIDS itself. Russia has been a long-time member of UNAIDS Program Coordinating Board. It's sort of like executive governing committee. And we've all been frustrated in the way that it's tried to limit or clip UNAIDS' ability to develop evidence and rights-based programs. But also we see that the UNAIDS regional support team is actually based in Moscow, and that has to be limiting its ability to do the things that are needed for the region as a whole. So I wonder what you think about what we have to do there with UNAIDS.
Yeah, I think it's a constraint in some ways, right? How you operate as a UN agency within it's the same for WHO. There are the constraints that a lot of what you can and cannot do is driven by the member states, and the amazing possibility we always had in UNAIDS is that we had a space also for other actors to be part of the conversation in a much more formalized way. So that's why we have always held UNAIDS so dear to our heart within the UN system, because there was a space where we could speak as civil society and our voices were heard, and the voices of people living with HIV, of key populations were heard. So that to one side. But as we have seen in the situation in Ukraine, there's a constraint being put around them because they have to operate with a member state that sits on their programming board and has been a difficult member state to deal with, has opposed often progressive type of conversations in UNAIDS. So it's a challenge, and I think it's a challenge that we will have to see how it will play itself out. But very obviously, it doesn't seem to be conducive to the situation that the support team is based in Russia right now. There are people who have been calling for that to change, and I'm hoping that there will be a change to that. But I think the broader question that you're asking, Ben, and that Elijah has also spoken about, is the much more important question. And I don't have an easy answer to that. But this is the moment, I think, where people are coming to the realization that we really have to make a fundamental change. And some of that will have to be in addition, but I also think there will have to be a rethinking of how our current structures are working, right? Are they really doing the best for all people in the world? And are we hearing all the voices? And are we really moving? And are we moving with pace? And my frustration is often in these structures that things are very, very slow. And slowness in policy debates costs people's lives, right? And people forget that sometimes when they sit in those spaces. When you don't make a decision for a year or two, that means people are dying for a year or two because you're not making the right decisions. So there's something in there. It's an opportunity, but it's also a challenge and could be a danger because, as we know, there's also forces who want to just get rid of that whole multilateral kind of consensus-driven decision making on global health and on human development, really.
And it strikes me we haven't been able to get into this too much in this particular podcast around the localization and decolonialization agendas. But one of the things we will obviously have to be aware of is that the multilateral system is precisely that. It's made up of different countries around the world. And as much as we wish to prioritize evidence and rights-based approaches, we need to bring the entire global community along with us, and that's a challenge that clearly we haven't succeeded in. We've made it worse, perhaps, through the poor distribution of COVID vaccines, and it's clearly something that's come to the fore during the invasion of Ukraine. And I know, Christine, we'll come back to this in a future podcast, but I'm realizing it's time really to let you guys go after a really intense conversation, and I want to try and be optimistic and forward looking. And Pavlo, maybe I could start with you on this question. We don't want to look into our crystal balls and imagine what the world will be like in a year's time. But what do you hope for? You're responding to day-to-day crises, but getting on top of this, what would you hope for in the coming year?
Well, I was listening to your previous questions and was trying to put my mind around it. Basically, being in Ukraine, it's really hard to look at this geopolitics, from here. It's really hard to realize that, people are trying to get consensus with someone who is doing genocide and killing people. I mean, it's really. Consensus is important, but with someone who is doing this, I don't think it's. You can't find any middle way. It's just not possible. I mean, you cannot negotiate that they will kill less people, a little bit less people, or being Ukrainian right now, I think it's being a part of a vulnerable group. Basically, I feel like that. I was just thinking about we've been speaking about the methadone. People were taking the pills, but here we have the situation where we need to, the troops, the Russian troops, the military is taking the lives of people. It's not about pills. It's about the existence. And I think my hope for the future that we will win this, because this is not the choice of different alternative healthcare system. It's a choice of existing and not existing, being and not being. And for us, it's the only choice. We just want to to be here. We want to live. We want to be part of the this Earth's population. And global community, and we want to exist. We want to exist in our own countries. We want to be able to do whatever we think is right for us. We want to keep to our values, including the values of freedom, human rights, and being able to choose what is best for you and your family and your country. I think this is something that we are fighting for. And after we will win, I think we will do our best, and to influence the global systems which are not really well responding, I think, at this moment. And it's just a challenge which probably many of those systems will not pass. And there should be a lot of changes, I think.
Well, I think you captured it. You don't reach consensus with authorities that believe and practice genocide, right? But Elisha, what does the next year look like, do you think, from a global health Washington, D.C. perspective?
Well, I think in the immediate term for us, I mean, we're pushing the U.S. to respond on multiple fronts with additive resources. I mean, President Biden has put forward a number of supplemental funding requests to Congress, both for aid to Ukraine, food aid, because I think we also all recognize the ripple effects as well of the war on other crises happening around the world and potential for malnutrition. And again, keep trying for that COVID supplemental funding so that we can address getting shots in arms, all over the world and really get to that equity piece that we started for so long. So I think there's that, and just also making sure in the coming year that we aren't robbing Peter to pay Paul, right? In the US, I mean, there is a tremendous need in US bilateral aid and contributions to multilaterals around essential health services. And we need to make sure that we're making progress on that. I'm struck by Pavlo's comment that, Christine and I and you, Ben, are talking about these geopolitical shenanigans, I guess, while they're really struggling for basic existence in Ukraine. And I saw a quote today from Dr. Tedros, who you mentioned earlier, the Director General of the WHO, who said, there's only one remedy for the disease of war, and that's peace. So I think that's what we're all hoping for in the next year, sooner, not just the next year, soon.
Yeah, amen to that. Christine, I mean, I think this is the moment, actually, that the world has been waiting for Frontline AIDS. The partnership model that you embody and live is more important now than ever. What are your hopes for the next year, both in Ukraine, and obviously for Global Fund replenishment, and the role of communities in driving the end of epidemics?
Yeah, I'm glad you asked me what my hopes are, not what the next year looks like. Because I think in the last 2 years, we have learned that you can never say what next week is going to look like, let alone what next year is going to look like. I mean, first of all, just really honoring what Pavlo has said. First of all, we really need peace, right? We need peace in Ukraine. It is just so heartbreaking every day to speak to colleagues and friends and see that impact. And I think the longer it goes on, the harder it gets, right? People are, when it was a week and 2 weeks, it's different. And now it's like, it's becoming a new normal, and I can see the impact on friends and people in the community. People are really worn out, and it is hard. It's really hard to sit there and for you to even still continue talking to all of us what the great broader implications are. Pasha, is really heartwarming that all of you, Andre, that other colleagues in APH have continued, and other community members, to participate globally. I'm always amazed that you do. So thank you for that. So first of all, I really, my hopes are really for peace in Ukraine, but also peace in other places. As Elijah has said, it's not like this is the only war. This is a war that has global implications in terms of supply chains and so forth. But we know that, we have a war in Ethiopia. We have a terrible situation in many other parts of the world. I really hope that there is some learning. Like you said, Ben, it's been shocking to see how little learning we carried from HIV into COVID. So hopefully when we are experiencing these crisis situations and we see the importance of communities in that, let's carry that learning into something else. And let's really find a way, a different way. I don't know what the way is, but really a different way to have a structural conversation of what would work better as a global system that is less bureaucratic, more agile, and that doesn't rob Peter to pay Paul, right? Where decisions are made in the right places with the right people around the table, and where resources are not always coming. Let's try to say HIV is more important than COVID and Ukraine is more important than another humanitarian crisis. There is no competition of crisis and suffering. So, and there is enough resources in the world, right? So I really hope that some of these crisis situations really push us into a different way of addressing them. And I know that's probably overly optimistic, but that's also ends with a bit of optimism.
And I sort of been thinking a lot about the history of the creation of the UN, and the incredible creativity that happened in the final years of the Second World War as people were beginning to think what a future structure should look like. And I think we're at that point again. I think COVID and Ukraine and other catastrophes, such as we have seen in Syria, in Yemen, and the DRC, Democratic Republic of Congo, all of these are demanding that we rethink and make our international cooperation mechanisms fit for purpose. So that's really what I'm taking out of this. I think to wrap up, Pavlo, could I give you the last word? And again, talking to our audience around the world, what's the one thing that you would like us all to take from today's conversation?
I think everything which was said is important in this conversation. I don't want to take any word out of it. And out of this discussion, it was really important. I just want to say thank you for supporting us, and we don't feel lonely here. And we feel that, being in this terrible situation right now and being not alone, it's really helpful. And I think this is something that this global organization should be doing. And just, people who are in this situation will not feel they abandoned.
Well, I know we are all committed to that solidarity. So Pavlo Smirnov, Elisha Dunn-Georgiou, and Christine Stegling, thank you so much. You are all incredible shots in the arm.